Good morning and welcome to Rising. We've got a great show for you today. Robbie, what do we have?
Team Rising weighs in on the Republican infighting between Minority Leader Mitch McConnell and President Trump's allies in Congress. Plus, Julian Assange's brother and filmmaker Gabriel Shipton joins us to discuss the latest updates on the case. And of course, Kim Iverson will be joining us later on. But first, Senate Democrats voted to raise the debt ceiling yesterday. Senators voted 50 to 49 along party lines to raise the debt ceiling by $2.5 trillion.
And Senate Majority Leader Chuck Schumer is threatening to keep the Senate in session and voting over the weekend into the week of Christmas to break up the backlog of 158 Biden nominees awaiting action in the Senate. Schumer blamed the backlog on a handful of Republicans, including Senators Josh Hawley and Ted Cruz. Hawley has vowed to keep his holds on nominees until there is, quote, accountability for Afghanistan, while Cruz maintains his opposition until a vote on legislation to place sanctions on the Nord Stream 2 pipeline. Also yesterday, Manchin and Joe Biden continued their talks. Manchin is insisting that the one-year child tax credit and the other kind of short-term programs at the beginning be paid for the entire stretch of the time, by which he doesn't mean he wants to raise taxes. It means he wants to get rid of the program.
Right.
So that remains a question mark. Chuck Schumer is still saying he wants to get this done by Christmas. At the same time, the Senate Democrats met yesterday on carving a voting rights exception out of the filibuster. And Mark Warner today, or late last night, said that, you know what, because Republicans simply aren't going to agree to this, I'm okay with reforming the filibuster in order to allow voting rights to go through. Now, Warnock almost voted against the debt ceiling increase, and he told reporters he was very close to doing that because he's like, wait a minute.
Warner or Warnock?
Warnock.
Warnock.
Beat right. Raphael Warnock from Georgia because he said, look, how on earth are we going to make an exception to the filibuster for the debt ceiling, which is what they did and why it could pass 50 to 49, but we're not going to do it for voting rights? Why is one more important than the other? Voting rights are central to the functioning of the Constitution. Like without voting rights, you don't have a government. You don't have a government that's accountable to people. He ended up not blowing up the global economy. He voted for the debt ceiling. But now that there's a chip in the armor of the filibuster by using the debt ceiling, it does seem like, if you do it for this, you do it for that.
Right. You can do it for whatever you want. You can, but the filibuster is not something that has any integrity on its own. Right. It's not, there's no filibuster provision in our Constitution, in our founding documents. Just kind of the quirk of history. It's just a thing that exists that you need 60 votes to pass legislation. Right. Not something that I'm necessarily even opposed to. It makes it harder to pass legislation. There's lots of bad legislation out there, but for confirming people to positions, for doing all that kind of stuff. Right. It's getting in the way of.
And the confirmation thing is a mess too. And it's not just Republicans' fault. Yes, they are holding up a bunch of nominees for their own parochial interests. They want to mess with Russia. They want to get mad at Biden over Afghanistan. That has nothing to do with a commerce undersecretary. The problem is, why on earth do all of these low-level government officials need their own up or down vote in the United States Senate? It's absurd. These are practically career positions. And so it is now.
Well, and if they don't get appointed, then you just, it's not like then that function is not being performed. Then whoever the highest official in that position, who is a career employee, is then just doing the job, right? It's not like.
Right, but then they're doing the job. They're doing 8 jobs.
Right.
And the government's that much less functional. It's December. He's been in office now almost a year, and you're it's okay. Let's say it takes a month or two to get staffed up. I understand that. A full year, and there are still all of these undersecretaries, deputy secretaries, assistant undersecretaries that still haven't been approved. I asked Schumer at his press conference yesterday if he thought there needed to be some rules changes around that also, and he didn't rule it out, but he didn't address it. He wants to keep the focus on Republican obstruction, which is a thing, but it's not the whole thing.
Right. Well, new data from Pfizer's clinical trial on its oral COVID-19 antiviral drug Paxlovid promises a high level of effectiveness, the company said Tuesday. The drug was found to be 89% effective at preventing high-risk people from dying or being hospitalized with COVID. The findings are consistent with the results the company released last month when Pfizer halted its clinical trial and submitted an application to the FDA for emergency findings. The Biden administration said last month it planned to purchase 10 million courses of Paxlovid. However, the FDA has not scheduled a meeting of its advisory committee to review the application yet. Senior columnist for the Washington Examiner, Tim Carney, questions why Congress and the administration are lacking a sense of urgency to get this pill out in the public, saying, quote, because it's not a vaccine and because it acknowledges the reality that everyone will catch COVID eventually, Paxlovid has little love on the left, but because it's not ivermectin and is made by Pfizer, it has little love on the right. And so this clinical trial was halted because they decided that it would be unethical not to give the control group this drug because they were so convinced it works.
Right.
So if it's good enough to do that, just let people have it. People will die. How many hundreds, thousands of people will die between now and whenever this drug is actually available because the government just... the government's moving as fast as the government tends to move, which is still not nearly fast enough. Because you could just approve it or approve it now, get it on shelves, get it into doctors' offices, do whatever you need. And then later, if you find out, ooh, this doesn't really work that well, then retract that approval. That's
or massively expand the experiment. Call it the trial if you want to. Like do that. Like if somebody is at high risk and catches COVID and is unvaccinated, they need this.
Yeah.
And so let them into the trial.
Yeah.
And then just monitor them. And also, obviously, they can choose. Like say, hey, look, this is a trial. And that's how these trials go. Like people participate in trials. So just make it a massive trial if that's the way that you have to like cut the red tape to get through here. I don't know if it's the case. And the numbers are wild. Like the number of deaths in the treatment group is like 0.
Right.
Now, we're talking about 1,000 people getting treated or something, so it's not like a massive number, but 0. Like that, so everybody who's dying in the control group is somebody that wouldn't have died in the other. And that was only like 9 or 10, but still 9 or 10 people out of that 1,000. That's 9 or 10 lives snuffed out for no reason, plus the 1,200 people that we have dying every day, because it's going to take an awful lot of time to get it to drugstores, to get it into people's hands. People are catching COVID at an expanding rate.
Right.
So this 1,200...
It's not going to slow down anytime soon.
No, 1,200 that'll be a number that we'll be shooting for.
Yeah.
If we get up to 2,000, 3,000 dying a day again.
Yeah. Oof.
So the Johnson & Johnson vaccine produced virtually no antibody protection against Omicron, but appears to provide some defense against Omicron in the stimulation of immune cells. And as Omicron continues to be the dominant strain in the UK, new data is giving experts hope the new strain may be no worse than a flu. According to the first major study into the new variant, it shows that far fewer people have needed intensive care, with just 5% of cases admitted to the ICU compared to 22% of Delta patients. Data from South Africa found that although there were high numbers of breakthrough infections in people who had been vaccinated, cases appeared to be less severe, and this was backed up by anecdotal evidence from doctors on the ground. So that's
more
encouraging.
Of what we're hearing, that it's a more mild disease, but the vaccine is not doing a lot to stop you from getting it. Obviously, presumably it's having some effect. You're better off with it. But it is protecting against severe disease and hospitalization and death, or the strain just happens to be less lethal. If you should get vaccinated, get boosted if you think that's appropriate for you. It very well may be, especially if you find into a category. Yeah, if you got Johnson & Johnson, get a Pfizer or Moderna booster, and that's all we can do. And hopefully we'll have these therapeutics available, Paxlovid, other things, and what else can we do?
Yeah, and we can just hope that, along with its slightly milder nature, that maybe the mutations did something about long COVID, and you're less likely to.
Maybe this will be the one to get, because everybody's going to get it. You're going to get it eventually. You haven't had it yet. You're going to get it.
I hope not. and I hope that we can. It's not impossible to eradicate viruses. Like it happens.
It feels pretty impossible.
It feels.
This thing is really infectious. It is. It's so much more infectious than the flu.
But it could But the other way it could eradicate itself is by mutating into something completely harmless.
Right.
I don't want to give up yet on the prospect of a world without COVID.
Yeah,
I'm not ready to give up.
I think everybody's going to get it. When you get it, you're going to wish you had the vaccine, or you're going to have had the vaccine, and you're
be like,
in all likelihood you're going to have a
Yeah.
mild experience. But there will be people who did everything right, who got vaccinated, who got boosted 18,000 times, but maybe they're overweight, maybe they have a immunocompromised condition, maybe they're elderly, and they will die, and that's very bad. But
This is bad.
There's
and
so
also,
much we can do.
We're going to be old one day.
You and I?
Yeah.
No, I don't plan to.
That's
ever
another
be
reason
old.
I wanted to be gone. People are like, hey, 65 and over, you're not 65 and over. Well, guess what? I hope to be 65 and over one day, and I'd like to enter my golden years in a world in which you're not going to die. Just go to the grocery store.
Yeah, my plan is not to age, but I see where you're coming from, Ryan. Kroger announced yesterday that it will take away paid leave for unvaccinated employees who contract COVID-19. The chain will also require its salaried non-union employees who are unvaccinated to pay a monthly $50 health insurance surcharge starting in 2022. Kroger will still provide paid leave to fully vaccinated employees who get breakthrough cases.
Former U.S. Surgeon General Jerome Adams weighed in on these new policies, tweeting, quote, "We're going to see more of this from companies. It's not about politics, but the bottom line. Businesses are increasingly viewing unvaxxed as a workplace liability."
Yeah, this is very interesting because, and I was seeing someone, David Frum, I think, writer for The Atlantic, former Bush administration guy, a long time ago. He tweeted something like, okay, COVID is here to stay. Here's what we should do. Here's what we should do. And one of the things he suggested was hospitals should quietly, they don't say they're doing this, but do triage care so people who come in who are unvaccinated, you shunt them to the side. You take care of the vaccinated people first, because those people who behave responsibly, so they deserve it. We're getting a little into this, which is not the kind of progressive view of how healthcare should work, right? Everybody should be taking care of each other, and we're all contributing to this kind of community health regime. So I'm going to pay and cover and support your health needs and you mine, even if yours are greater than mine. That's sort of the progressive ethos. It's not exactly my ethos, but that is the progressive ethos.
Right. No, he's not a progressive.
Right. He's not a progressive. But we're running into that kind of. But you see lots of.
Yeah.
Right.
No,
but you see lots of progressives talking about, we have to provide medical care for these people on ventilators.
Because they're allowing their kind of emotional anger at the unvaccinated and their polarized politics and the fury that they have at this other to color the way that they understand the world in a way that they themselves could recognize as wrong if they would just step back and be like, you wouldn't say that somebody who is obese doesn't deserve to get diabetes care.
Yeah.
They wouldn't say that. Unless the obese person was wearing a MAGA hat and yelling at them, then they're like, you know what, you die. Like that's how strained.
We're going to get into that. Two people come to the hospital, go, well, this one's unvaccinated, so we're not going to treat them.
Right.
Oh, but the other one was at the Capitol riots. So now we're starting to.
Right.
What are
vaccinated,
your good
but
person?
At the Capitol riot. Yeah.
Good person points. Yeah. Not good.
Like
that is
China
dystopian.
Does that. China has that.
Right.
You get points for helping people cross the road, stuff like that. Anyway, we will tell you what's on our radars up next.